So, silicone can get in your lymph nodes, in particular armpit, if you have silicone implants. And this is one of those complications that sounds a lot scarier than it really is in reality. So, in truth, we really don't know what percentage of women with silicone implants have silicone in their lymph nodes. Now, there are some studies, like if you look at open evidence, and they'll say that like a very high percentage of women who were having their implants removed had silicone adenopathy, but they don't quantify how many of those patients had ruptured silicone implants or how long their implants were in place. And we know, of course, that older implants were more problematic because the silicone was more liquidy. It was like Karo syrup and not like the gummy consistency we have now. So when they ruptured, and they ruptured more easily, they had a thinner shell, they would get in your breast tissue and get in your lymph nodes. And so for the true numbers with today's current generations of implants, anything from like 2005 on, I don't really know. I can't tell you what the risk is. What I can tell you is I've never in my entire career seen a patient with silicone in their lymph nodes where it was blocking lymph flow and causing swelling. It certainly can happen, but it is not a common thing. And remember, I specialize in breast, and all I deal with is breast implants all the time, and I've not seen this. There was a study that looked at women with silicone in their lymph nodes and found that like 70% of them were asymptomatic, which means no symptoms. They just found them in the lymph nodes on biopsy, but nothing was going on. And then some women ended up having pain in the area. And then some women had lymph nodes they could feel that weren't painful. So, and I think you have to think about the reason why we don't really know, because most women with breast implants don't have trouble where they have to have their lymph nodes looked at. And so we're typically looking at lymph nodes in patients for a reason. So they're a breast cancer patient that had pre-existing implants, or there's a large group of women that had their breast implants removed because they believed they had symptoms from their breast implants, and there were some charlatan doctors just biopsying lymph nodes willy-nilly as part of their treatment. They weren't doing anything with those results, but they were biopsying lymph nodes. And when they found silicone in the nodes, they would use that as a justification for everything they were doing. So although silicone in the lymph nodes sounds really, really scary, the reality in real world breast surgery is we don't see it a lot. If we do see it, it's not causing patients any problem. And the improvements on the implants that have been made over the last several decades have reduced the chance of that happening. So if you're concerned about getting silicone in your lymph nodes, this is a great thing to discuss with your surgeon if you're considering breast augmentation or breast reconstruction with implants. And it's also a really great reason to remind you that implants need monitoring. And we do know that having implants for a long time and ruptured implants increases the chance that you have this. So once you have implants, make sure you're getting your MRI or ultrasound after 5 years and every other year after that, so you can catch ruptures quickly and minimize the chance you have this problem.